Hi and welcome to day 13. Well, yesterday I think I said that cholesterol was my favourite topic and I'd talk about it for hours. Well, today we're talking about blood pressure, and my confession is this is probably equally my favourite. And I don't want to be thought of as boring or dull because most of my colleagues who are excited about putting in new valves and putting in stents when people are having heart attacks or putting in devices to help people's hearts function get all excited about the expensive, shiny toys that we can do when it comes to cardiology. And me, I seem to get really excited when we can do the really simple things well. And one of those really, really simple things is blood pressure. And before I go too far, I really want you to understand why I get so focused on it. Well, let me paint this picture. Imagine I've got a blood pressure of, say 120. And that's my blood pressure. It's absolutely fine, but it creeps up over time to, say, about 130, 135 systolic. Should I be worried about that? Should my GP say things like, oh, your blood pressure's up a little bit, maybe we should keep an eye on it, let's check again in 6 months' time, and so on? Well, let me frame that up for you. Going from 100 to 130 to 135 is a 10% increase. And when you think about it, your heart is beating 100,000 times a day. 100,000 times a day. When you think of it like that, would you really want your heart, the most important pump in your body, in your life, to be working 10% harder than it needs to? I don't think so. Blood pressure is so important because it's so easy to get under control because we've got really good medications for it. And raised blood pressure has such deleterious effects. Increasing the blood pressure puts wear and tear on the arteries. Once you start to damage the arteries, you can have problems with the arteries going to the brain, causing stroke, the arteries going to your heart, causing heart attack. You can also put stress on the heart itself. You can stretch it a bit out of shape. And if you stretch the top chambers of the heart, the atria, you can drive atrial fibrillation. If you put load on the bottom chambers of the heart, the ventricles, you can end up getting cardiac failure. That raised blood pressure also goes through the glomeruli, the small structures, the blood vessels of the kidneys. And you guessed it, if you're driving too much pressure through your filtering system, you can damage your filtering system as well. Renal failure. And we're getting more and more evidence that raised blood pressure is linked to dementia, and lowering blood pressure can push dementia away. So think about it. Increasing your blood pressure increases your risks of stroke, heart attack, atrial fibrillation and cardiac failure, renal failure, and even dementia. So if you've not had your blood pressure checked lately, go and get it done. If there's any question about it, don't let your doctor say, look, we'll keep an eye on it and we'll check it in a few weeks or a few months or next year. It's not his heart. It's not his body. It's yours. One of the things I use a lot is a 24-hour blood pressure monitor. That's a cuff you wear for a whole 24-hour period. It takes multiple measurements, so it gives us a really, really good idea of exactly what we're dealing with. It tells us if someone's got white coat or not. It tells us if your blood pressure's up overnight while you're sleeping. Look, do check out the resources today because there's some good stuff in there to get more information. But whatever happens, please get your blood pressure checked and please get it properly controlled. It pays huge dividends. At 100,000 beats a day, look after your heart by reducing the load that it's working against. I look forward to seeing you tomorrow. I do wish you the very best. I hope you live as well as possible. For as long as possible, take care and bye for now.